After a 2-year delay because of the COVID-19 pandemic, medical schools are beginning to sponsor global missions where students treat people in developing countries. Kansas City University is one of those med schools, and Dr. Desai, professor and chairman of primary care at KCU, usually joins us from the campus on Tuesday mornings. Today, though, he is in Guatemala. So good to see you with that beautiful sunshine behind you. The first question we have for you is, what are you and the medical students doing there?
Well, every year our university typically conducts some outreach in different countries, including Guatemala. And last year, for the first time in 21 years, we were not able to go because of the pandemic. So we're here providing care for patients that don't have access. So for example, today we're in a hospital, but there's no doctor here. So a lot of patients can't afford to see a physician. So we're just providing free medical care and giving free medications to the patients.
And how does this impact the students? Do you think that it helps them become better doctors down the road when they're treating their patients after they graduate?
Yeah, I think it helps the students in many ways, which in turn helps us in the United States. And I know when I need a physician, I want someone who's empathetic and kind. And so a lot of the students learn to improve those skills here because, you don't feel that well off in the US when you're a medical student and you have a lot of debt. But when you come to other countries, sometimes you'll see people that are less fortunate than you, so you feel a little more empathetic. In addition to that, the students here get better at diagnosing things because they have to rely more on their eyes, ears, and hands instead of relying on technology like we often will do in the United States. So that translates to better care for all of us back in the US.
And what about the people there that you are treating in Guatemala? What kind of a response do they have to the patients there who are working?
They're very, very appreciative. They always are, but I think this year even more so because of the lack of access from COVID. A lot of the doctors that had been seeing patients were called away to the larger cities for the resources there, which left them understaffed here. So they're very thankful. We have a lot of patients that make the beautiful hand-woven dresses and designs that they wear. And, they'll get reading glasses and they're just so happy because now they can get back to work. Or they'll get a joint injection and now they can go back to work on the farm and not have pain for a few months because of that injection.
And this was really quite the trip for you. Do you have any thoughts, any tips for people who maybe want to get back to the international travel?
Yeah, definitely. I had many a sleepless night before we left because there's just a lot of factors at play. Sometimes the rules for travel will change overnight. We were not able to log into our third-party app to upload our COVID vaccine. So I recommend talking to the airline, looking on the government of the country you intend to visit website, and trying to talk to locals if you can as well, because they can give helpful tips on how best to navigate this ever-changing travel process with the different requirements for each country.
All right, Dr. Desai, thank you so much for your time. We hope you enjoy your trip, and we will see you when you get back.
Thank you so much. It was my pleasure.